I'm a practicing pediatrician in Mumbai, and this is regarding a project called Docterz, what we are developing for the last 6 years, where we are trying to build technology from a doctor's perspective. So the way we operate, the way we work, the way it's going to be beneficial to the doctor community. Keeping that thought process in mind, we have been developing this project, and obviously there are a lot of doctors who have joined the platform, and this complete product is built on doctors' feedback. So as and when they join, and their suggestions, we keep on adding to the product, and that's how the product has matured. So what essentially we are trying to do is, there are two things to this. The first thing is that once you start using technology, it's not only the prescription side which is interesting. A lot of data gets generated, and this data actually helps in a lot of things. So you can see what kind of patients are coming from which area. If you want to invest in a device, you can know what is the target audience you have addressed. You can see how many diabetics you have treated, how many hypertensives you have treated, how many patients have not taken a particular vaccine, how can you reach out to them. Patient quality indices, waiting time, like waiting time. If your waiting time goes high, you obviously know that patients are going to change doctors. So how do you measure the waiting time? Or what is the average patient retention rate? Or if you increase your charges, what was the impact? So this data which gets generated is very useful in planning. So we help doctors with that. The second objective is that, which is probably slightly more complex to understand, is when you start using technology, there are a lot of digital spaces which get generated, and we help doctors build their own digital properties. So digital properties means what? We give each and every doctor their own application on Play Store and App Store. So these digital properties are assets for the future, because patients are going to download, because they are in your name, in your hospital's name, in your clinic's name. That is a tool from where they can not only connect, they can see their prescriptions, records, invoices, they can see your departments, services, testimonials, your work. And there can be a lot of value unlocking happening in these digital properties, like through promotions or partnerships or sponsorships, where people would like to basically advertise to showcase their products. So these digital properties are going to be things for the future. So that is what we work on, and to facilitate that, obviously we are building the complete OPD ecosystem. So when a patient comes to your cabin, once he comes inside the cabin, or once he comes to the hospital, once he's registered, there is a queue management system which runs on the smart TV, which will tell them what time the doctor will call them inside. So we are the first in India to engineer it where it runs on real time. So once the patient walks inside the cabin, how we have developed the system, so you complete your interaction with your patient, you complete your history taking, examination, everything. Once you come to a probable diagnosis, the first thing you enter into the system is a diagnosis. Suppose you put in diabetes. The moment you put in diabetes, the system learns what are your common complaints, findings, what are your top brands for diabetes. Suppose you pick up a brand for diabetes, it will automatically populate one tablet OD for 15 days. So based on your previous behavior, the system will keep on learning, and it becomes faster and faster. And that's why it becomes very easy to use technology. The system grows on you, because over a period of time, you just need to keep on selecting. There is no templating, because the system auto templates. Not only that, you can give videos, you can give handouts. Suppose you want to give some educational material, how to take insulin injections and all. So that you can give. The complete billing, your inventory. The patient goes home, if he wants to connect with you, then he can connect through a chat, telecall, video call. So the patient satisfaction component which is there, that is taken care of. You can monitor the lab trends, you can monitor a particular disease trends, like if you want to see HbA1c, or if you want to take out a particular data set, like if you want to talk to your diabetics, or you want to talk to your diabetics more than HbA1c more than 10%, or if you want to see which patients have not taken the flu vaccine this season, you can send them a message. So this targeted engagement, which is very important and relevant for the patients, you can do that. So the complete chronic disease management program which is there, that we have built. And for data security, we were the first in India to build a system called multi-tenancy. So what happens in multi-tenancy is your data can be hosted on your own cloud instance. So the highest level of security is something what we can build. And most important, when patients come to you, they won't be downloading a third-party app. They won't be downloading our application. They will be downloading your application, which is an asset for you. So in short, we will help you build your own brand digitally, which will unlock value in time to come. So this is the project what we are working on. We have worked with close to 1,000 plus doctors all across the country, and we look forward to working with you as well. So please join for the product demo.